Greetings. I'm Dr. William Richardson, Medical Director and President of the Atlanta Clinic of Preventive Medicine. And I want to talk to you, discuss with you our uterine fibroid therapeutics program, and we'll be referring to the handout from the Atlanta Clinic of Preventive Medicine, Dr. Richardson's uterine fibroid therapeutics program. What I'll be doing is reading mostly from this page and giving you information filling in the blanks. First of all, let's review the facts. It's estimated that 80% of all U.S. women have uterine fibroids, but only 1/4 have symptoms requiring treatment. So this is a great epidemic, as you see. 1.6 million women in the U.S. per year are diagnosed with uterine fibroids. African American women are 3 to 5 times more likely to develop symptomatic uterine fibroids than Caucasian women, due, in my opinion, to the lifestyle and diet that is poor. Unfortunately, it appears that an alarming rate of hysterectomies are being performed as a solution to uterine fibroids on especially African American women. Amazingly, over 600,000 hysterectomies are performed in the U.S. annually, 25 to 50% due to uterine fibroids. Over $5 billion are spent annually on hysterectomies. Average time off from work to recover from a hysterectomy is 6 weeks. That's a considerable amount of time. 60% of all women undergoing hysterectomy have their ovaries removed. This results in castration or sterilization of the female. 660, that's 660 women die each year in the U.S. due to complications of having a hysterectomy. Complications and side effects of hysterectomy include adhesions requiring more surgery, incontinence, and alteration of sex drive, and possibly hormone replacement therapy. Increased incidences of osteoporosis, arthritis, cardiovascular disease, depression, and memory loss. While in some cases uterine fibroids have become so life-threatening that a hysterectomy may be the only option. However, according to a report published by the American College of Obstetrics and Gynecology, 75%, up to 75% of hysterectomies performed did not meet established guidelines set forth as necessary for hysterectomy. Also, unfortunately, too many women report being given unwise and unfounded advice as to why they should get a hysterectomy. Check these out. Hysterectomy is the only way to cure or control fibroids. That is simply not true. These are statements being told to women why they should get a hysterectomy. You've had enough babies. You only need your uterus if you plan on having more babies. You don't need your uterus after menopause. Your uterus is just a site for cancer. Your insurance will cover it. Conventional medical approaches to treat uterine fibroids include do nothing, hysterectomy, myomectomy, which is removal of the fibroid but preservation of the uterus, uterine artery embolization, where an artery is blocked that supplies the fibroid, and hormone estrogen suppression. However, none of these conventional medical approaches address the root causes of the fibroids. And that includes, what are the root causes of the fibroids? Toxicity, congestion, constipation, hormone imbalances, poor diet, lifestyle problems that can and will create more fibroids, as well as other health problems. So let's look at some of the side effects from the hormone estrogen suppression. You can get cancer. Uterine artery embolization can make you infertile. Myomectomy and hysterectomy are major surgeries. Moreover, if you've been diagnosed with uterine fibroids, our advice is to get effective treatment soon, before they grow larger, become life-threatening, or give you bothersome symptoms that severely affects the quality of your life. Furthermore, there is a growing trend in responsible holistic medicine today to investigate, integrate, and utilize all healing modalities and other alternatives other than conventional treatments of hysterectomy, myomectomy, uterine artery embolization, drugs, and do nothing, that just wait and see to solve the problem of uterine fibroids. These more natural methods or holistic methods include natural, non-invasive, alternative approaches like extensive cleansing and detoxification, major dietary changes, major lifestyle changes, herbs, nutritional supplements and superfoods, healing exercises, natural hormone balancing, and elimination of known and suspected risk factors. Basically, we should understand that uterine fibroids as well, in fact, as ovarian cysts, fibrocystic breast disease, and any other tumor found in the female reproductive anatomy largely occur for three major reasons. One, toxicity, congestion, sluggishness, stagnation, and constipation in the blood, lymphatics, liver, colon, uterus, and overall system. The second major reason is hormone imbalances, especially excessive estrogen buildup. And that can be related to constipation because constipation tends to make the estrogen level rise. Also, certain foods have estrogen in them, as well as pesticides have estrogen-like effects, as well as heavy metals like cadmium have estrogen-like effects as well. And also the third major reason, besides toxicity, congestion, and hormone imbalance, is the standard American diet and lifestyle, which includes high fat, high sugar, high salt, white flour, chemically latent, steroid latent, antibiotic latent food, low in fiber, low in fruits and vegetables, low in vitamins, minerals, enzymes, lack of exercise, high stress, etc., etc., etc. Therefore, our philosophy and approach for treating patients with uterine fibroids rests on the understanding that uterine fibroids are a long-standing disease that have been developing for many years, even decades, and that has many known and suspected contributory causative factors that must be identified and eliminated. Our strategy then is to support and enhance the body's own innate healing abilities to regenerate, rejuvenate, and heal itself. We want to support and enhance the body's own cleansing and detoxification and defense mechanisms, mobilize all of the body's own internal healing forces, and assist the body on all levels to minimize, neutralize, and or break down and slow down the growth of uterine fibroids. Many patients have had tremendous success in eliminating or shrinking fibroids and thus reducing and eliminating symptoms that may be life-threatening or seriously affect the quality of life. Many times I'm walking through health food store, farmers market, just on the street, and patients come up and say, "Oh, thank you, years ago," I don't even remember them, but they say, "Years ago, you put me on a program and I'm not bothered with my uterine fibroids anymore." How's that for a follow-up? 5 types of patients typically are treated in our program. 1, patients who have proven fibroids who refuse any type of conventional therapies. We therefore offer a complete program to attempt to eliminate, shrink, control fibroids using a variety of alternative modalities that address the causative risk factors. 2, patients who have proven fibroids who have exhausted conventional treatment, drugs and hormone therapy and surgery, or who refuse to get a hysterectomy or myomectomy at this time. 3, patients who have already undergone more conservative conventional fibroid therapy, such as drugs, hormone therapy, myomectomy, uterine artery embolization, or partial hysterectomy, and have successfully gotten fibroids eliminated, reduced, or under control, who would like a preventive program to enhance their defenses or reduce the very common chances of recurrence. 4, patients without evidence of fibroids at the present time who have a strong family history of fibroids who simply want a program to help reduce the risk of developing uterine fibroids. And 5th, uterine fibroid patients who are undergoing conventional therapy with a gynecologist who wish to be on a nutritional, lifestyle, immune system support program during the treatment. Key areas of my uterine fibroid therapeutics program include extensive study and education, major dietary and lifestyle changes, extensive cleansing and detoxification procedures, oral nutritional supplements and herbals, alternative testing, psychosocial, spiritual, emotional, and mental support, and other therapeutic healing approaches. In summary, our approach to treating our fibroid patients is to develop an integrated, individualized treatment plan. The objective of the plan is to improve the quality of the person's life, completely eliminate the fibroid production, shrink the fibroids to a manageable size, and eliminate the possibility of life-threatening symptoms, and eliminate or minimize all symptoms. Patients are encouraged to ask questions and learn about their bodies and illness and explore options and alternatives. We truly support the patient in her journey to recover and optimize their health. Now, we have a detailed description of my uterine fibroid therapeutics program. First, the extensive education and study. Each client will be encouraged and required to fully engage themselves in educational awareness and studies to become extremely knowledgeable and take an active role in her treatment. Dr. Richardson's manual on uterine fibroid therapeutics is a primary treatment and educational modality. To back it up, we have DVDs, videos, books, audio tapes, CDs, websites, resources, and helpful organizations. A client will have the opportunity to view, listen to, borrow, receive, and/or purchase these educational tools at any time. We feel the educational aspects of the program are very important so that clients can better understand their condition and treatment options. Secondly, major dietary and lifestyle changes. Recent studies indicate that 86% of our health and your health is solely due to diet, nutrition, lifestyle, and environmental factors. Therefore, we also understand that these same diet, nutritional, lifestyle, and environmental factors play a major role in the occurrence of fibroids. Furthermore, we offer a very detailed and lifestyle nutritional training program for each client that is individualized to best fit her needs and desires. From years of research and practice, we provide clients with a vegetarian-based dietary regime, cost-effective ways to eat organic foods, healing recipes for raw foods, raw juices and smoothies, soups, broths, properly cooked food recipes, a more safe approach to limited consumption of animal products, avoidance of tobacco, caffeine, alcohol, artificial and synthetic chemicals, white flour, conventional sugar, and white salt, recipes and restaurants to eating whole, unprocessed organic foods such as fresh fruits, vegetables, seeds, nuts, and grains. Proper food combining body clock mechanics, eating rules, and drinking rules. Recommendations on how to avoid environmental pollution at home, work, and hygienic products that are compatible with a healthy lifestyle. Exercise and stress management techniques including aerobics, weights, tai chi, yoga, meditation, deep breathing, and dance. Thirdly, we have extensive cleansing and detoxification procedures. Studies reveal that toxicity plays a major role in the development of fibroids. Therefore, we recommend that various procedures be used to help cleanse and detoxify the body. And these would include reducing and eliminating toxic substances entering the body in the first place, cleansing juices, foods, and smoothies, liver and colon cleanses and flushes, colonics or colon hydrotherapy, cleansing enemas, coffee enemas, cleansing herbs and teas, EDTA IV chelation therapy to remove heavy metals and increase blood flow. Also to decrease the crystallization of the fibroid with the chelation therapy. Removal of all mercury fillings, DMPS IV chelation therapy to remove mercury from the body and the systems. Special baths, clays, and poultices. Fourth, oral nutritional supplements. Considerable evidence exists that specific nutrients play a major role in protecting individuals from developing fibroid. We prescribe nutrients on an individual basis and often use laboratory testing to adjust dosages. These examples that will be emphasized for a uterine fibroid program include a full-spectrum, low-allergy multivitamin and mineral, vitamins C, E, and A, superfoods such as flax seeds and spirulina, Isiac tea, herbs and supplements for pain, bleeding, hormone balance, shrinking of fibroids, detoxification, stress, anemia, etc. Many of our patients are severely anemic. Fifth, alternative testing to help identify and minimize or eliminate additional root causes or contributory, complicating, or compounding factors regarding fibroids, such as the CDSA, or comprehensive digestive stool analysis, that analyzes the overall health of the gut. What is the pH of the gut? Is it acidic? How about candida and yeast load in the colon? How about disease-causing or pathogenic bacteria, friendly bacteria, digestive efficiency, and enzyme balance? The second alternative test is food allergy panel to identify and eliminate any foods causing significant adverse reactions in the body. The third test, heavy metal testing, to measure the amount of heavy metal load, lead, cadmium, aluminum, mercury, arsenic, etc. And the fourth, the female hormone panel, to check exactly what the natural or the actual hormone balance or imbalance is. We check DHEA, estradiol, estrogen, estriol, progesterone, testosterone. The sixth approach to this treatment for uterine fibroids includes the psychosocial, spiritual, emotional, and mental support. Evidence increasingly demonstrates that attitudes, beliefs, and personal stresses affect both the development of the illness and how effectively our bodies can fight back once it's developed. We believe in helping a patient to cope with illness on all levels in an optimistic and hopeful manner. Toward this end, we will recommend comprehensive individual and counseling or group support programs, prayer work, visualization, meditation, forgiveness work, re-evaluation counseling, laughter therapy, having fun, constructive therapeutic breathing, and music therapy, and many others. Other therapeutic approaches would be the seventh modality group that we offer, and we're constantly looking for methods to balance the body, to deal with the fibroids. We encourage fresh air, exercise as tolerated, both aerobic and stretching, as well as internal healing arts such as yoga, tai chi, meditation, and visualization. Plenty of rest and sufficient sleep. Patients have imbalances in the electromagnetic system of their bodies, and therefore we may recommend acupuncture, biomedical therapy, or homeopathy to correct these imbalances. Additionally, acupuncture, lymphatic massage, reflexology, or body manipulation may be recommended. We work closely with dentists to help prevent dental problems from interfering with your healing. For instance, in many cases, we may even recommend removing dental amalgams. In conclusion, we have a comprehensive uterine fibroid program. This is a major epidemic. We feel that we can offer many clients with a therapeutic response that is noteworthy and very beneficial for our clients and patients. Thank you.